tak sempat nak compress lagi. So anyway, today's session, I will not go one by one throughout the slide because I think you can listen to my recordings, kan? So what I'm going to do today is that I will open up the session for you to ask me questions regarding the parts that you do not understand. Okay tak?
Okay.
Alright, so this is just basically a recap on the anatomy of your kidney. Alright. So basically your urine output normally per hour dalam 50 to 60 mils lah. And in 24 hours dalam satu hari tu on average your body would excrete about 1.5 liters of urine per day. Okay, 1.5 liter. And then as we age, by the time you have reached around 35 years old and above, you will slowly lose your nephron. Okay. Okay, so come on, ask me questions. What is it that you do not understand about this topic? Sambil-sambil tu, I just go through very quickly on the slides. Okay, so these are the UTIs or some of the disorders that I have shared with you. Tapi kalau ikutkan, there are a lot more. Tapi I just choose the common ones that we see every day in the wards or at the clinic. Okay, so I started off with congenital conditions. Agenesis. Agenesis maksudnya A means without, genesis means formation. That means there is no formation of the kidney. Okay, kalau ada satu kidney, you are still viable to live lah. Tapi if you do not have both kidneys, then usually the baby will die in utero. Okay, it's not common to get bilateral agenesis. Selalunya most of the cases, probably 1 in 1,000 birth, probably you may get a unilateral renal agenesis. Okay. Hypoplasia, hypo maksudnya apa? Hypo means less lah. Okay, so the kidney does not fully develop in the womb masa dalam embryogenesis punya development. Okay, or dia terbentuk but the size is very small, very tiny, and because of this small size, abnormally small size, it does not work as normal as the normal size kidney. Okay. Ectopic kidney means that the kidney is located ataupun positioned at an abnormal location. Okay, selalunya your kidney daripada in the womb during the embryogenesis punya stage, it started off daripada around the pelvic area, and then it slowly goes up. As time goes by, your kidneys will slowly goes up, and then it will be located around the lumbar area. Okay, but in an ectopic punya kidney, the defect is either the kidney is located below, above ataupun the opposite side of its usual position. Alright. So bila dia dah berada di tempat yang abnormal, nanti this can lead to a poor development of your the other parts of the your urinary tract. Okay, ureter tu tak terbentuk dengan betul. Alright. Sometimes the patient may not present with any symptoms unless dia ada macam obstruction ke ataupun recurrent urinary tract infection. Alright. Horseshoe. My question throughout the recorded video as for post-renal acute renal failure, it is caused by obstruction. So it's also that what I understand that from renal stone can cause. Yes, if you have kidney stones, okay, nephrolithiasis, that causes obstruction to the urinary outlet, you can get a post-renal acute renal failure. Sebab air kencing you tak boleh nak lalu, so nanti dia macam sama ada it can cause stagnant, dia the flow of the urine to it's not good. Okay, there's no flow because of the obstruction. So nanti ada backflow, so it can cause apa nama ni, the acute renal failure. Tapi because it's acute renal failure, once the condition has been dissolved, okay, you dah settle the kidney stones, slowly dia akan come back to normal lah. Dia tak ada macam ni tau, macam let's say kalau you ada kidney stones tu ada dekat one of your any parts of the kidney, okay, and then dia takkan terus stuck tu, dia terus stuck sikit, dia terus menyebabkan acute renal failure. No, it takes a few apa orang kata, it takes quite some time juga untuk dia accumulate, menyebabkan the accumulation of your toxins, your urea, your creatinine tu, all the nitrous substances accumulated, then you can get acute renal failure. So masa tu patient tu mungkin dia tak tahu dia ada kidney stones, mungkin the kidney stones daripada the pelvic area, dia travel and then dia stuck dekat ureter. Okay, so dekat ureter tu sangat sempit laluan dia, so it gets stuck there. And then slowly it causes urinary obstruction. So bila ada urinary obstruction and then you are not doing anything about it, dia akan menyebabkan accumulation of all the toxic wastes, and this can cause an acute renal failure. Okay, and then bila kita remove doktor dah keluarkan kidney stone tu, dia flush out the urine, then because this is an acute, so it is reversible, so nanti kidney tu insyaAllah akan go back to normal. The problem is kadang-kadang if the kidney stones tu dia terletak a bit deep inside the kidney, okay, intrarenal, and then mungkin orang tu dia tak ada simptom sangat, ataupun dia ada simptom tapi dia buat tak kisah. So lama-lama dia tunggu kencing sakit, dia tak kisah, kencing tak lawas, dia pun macam alah biasalah ni sebab dah tua. So lama-lama mungkin because of the accumulated toxic waste kat situ, towards the end nanti the kidney cells tu dia dah tak boleh nak tahan, okay, then you can get chronic renal failure. So bila chronic tu usually a lot of the kidney cells dah rosak, so you cannot reverse it back. Okay, yang boleh reverse selalunya acute kidney failure, sebab dia macam dia datang sekejap je, kita you manage whatever that is blocking, whatever that is injuring your kidney cells there and there, then you insyaAllah kita boleh hopefully the kidney cells will go back to normal lah. That is an acute. Okay, very very subtle punya tempo. Okay, is there any other more obstruction other than the stone? Yeah, ada. Selain daripada stones, if you have, let's say contohnya ada tumor, okay, kalau ada pelvic tumor, contoh orang tu ada ovarian tumor, okay, ovarian tumor, nanti later on you will learn dekat reproductive punya pathology. Ovarian tumor, what yang bermasalah berkenaan ovarian tumor adalah when a woman has ovarian tumor, usually dia tak ada symptom. Okay, symptom untuk ovarian tumor, if it's a cancerous one lah, okay, kalau dia adalah sejenis cancer, sebab I bagi tahu dulu tumor tu doesn't mean that you are having a cancer. Tumor tu adalah sejenis ketumbuhan, sama ada benign atau cancer or cancerous, we need to do histology punya staging ataupun histology punya assessment. Okay, so let's say kalau orang tu ada ovarian cancer, so it's a tumor lah, okay, ketumbuhan yang sejenis cancer. And this ovarian cancer is usually very subtle. Dia tak ada awal-awal, when it is there, the patient wouldn't know that she has ovarian cancer. Selalunya ovarian cancer, it is diagnosed at a very late stage, okay, stage 3B ataupun stage 4 lah selalunya, and usually they do not have a good prognosis. So kalau orang tu ada ovarian cancer, the tumor slowly grows, and then lama-lama bila dia membesar, dia akan compress on, sebab dia dekat kawasan pelvic, okay, so it can press compress on the ureter, causing obstruction. So you can get post-renal acute renal failure from there. Ataupun apa lagi kalau orang tu ada selalunya tumor ataupun stone. Okay, tumor daripada your reproductive system ke, tumor daripada your bowel ke, right? So that can cause obstruction lah, right? Because they are situated quite closely together. Alright. Okay. So next one. So this congenital ni jarang-jarang lah kita jumpa. Cystic kidney quite common juga. Okay, this is due to disorganized renal development. Alright. And kalau cystic kidney ni kita ada autosomal dominant or autosomal recessive. Alright. So you see all the kidney cells yang normal one will slowly be replaced by cysts. Okay, cysts ni very thin. Okay, sometimes you can get fluid inside. Okay, so this is an APKD, adult polycystic kidney disease, and this is autosomal recessive. Okay. Okay, next is infection. Very common for you guys, especially women, to get UTIs. Okay, so kalau infection tu melibatkan your urethra, kita panggil urethritis. If it involves your bladder, kita panggil cystitis. If it involves the kidney, kita panggil pyelonephritis. So usually urinary tract infection dia akan start daripada bawah ke atas, ascending. Okay, and most of the culprits are your E. coli. Okay. Orang lelaki pun senang juga dapat, tetapi selalunya orang lelaki older men. Kenapa? Mungkin because of the hygiene punya causes lah. Alright. Children and elderly, okay, can also prone for UTIs also. Kalau perempuan, because of the short urethra, and then because the location is very near to the anus. So kalau you practice inappropriate hygiene, so takut nanti you boleh introduce the intestinal flora into your urethra, so you can get UTI. Alright. So yang ni rasanya dekat dalam video ada bagi tahu macam mana the mechanism of infection from ascending. Okay. Cystitis is inflammation of your bladder. So because UTIs are usually bacterial origin, kita bagi antibiotics. Okay, tapi tak adalah senang-senang kita bagi. Kalau macam patient tu just datang very mild complaint, kita akan advise the patient to drink a lot of water, practice proper hygiene. Okay, tapi kalau macam orang tu ada high grade fever and then it's already like 3 or 4 days, then we would give them antibiotics. So antibiotics is to combat bacteria. Kita tak ada bagi antivirus ke apa. Okay. So acute pyelonephritis is infection that affects your kidney. Again, most of the culprits are your E. coli and it's an ascending infection. Alright. So kat sini kalau some patient, they may be presented with a quite bad punya sign and symptoms lah. High grade fever, abdominal pain, sometimes dia muntah, sometimes they may get diarrhea. Okay. So these are the risk factors. Ni kalau ada abscess lah, ni all this yellowish thingy, all these are abscesses. Okay. Alright. This is the disease that affects the glomerulus. Okay, very common to get nephrotic syndrome di kalangan kanak-kanak. Kalau macam dekat ward tu, atau probably you sendiri pernah experience, or your brother or sister or your siblings, kalau doktor kata okay, buah pinggang dia bocor, this is actually what it meant lah. Nephrotic syndrome, bocor kenapa? Because of protein leaking. So bila dia kencing dia berbuih-buih. Okay, so these are the subtype, the condition that can cause nephrotic syndrome. Minimal change, very commonly seen in children. Focal segmental glomerulosclerosis, membranous nephropathy. All these are usually diagnosed through biopsy. Kita kena ambil sedikit sampel from the kidney tissue and then kita hantar histo, dan kita tengok the kita assess the changes lah, sama ada it's just a minimal change ataupun ada focal segmental glomerulosclerosis ataupun ada melibatkan your membranous. Okay, another type of syndrome that can affect the glomerulus is what nephritic syndrome. Okay, and it is usually due to selepas a non-specific upper respiratory tract infection by group A beta hemolytic streptococcus. Right. Okay, so ni just gambar. Kenapa dia tak keluar? Dekat you all ada keluar tak? Ini. Kenapa saya ni tak keluar? Nanti you tengok balik Nephritic syndrome ni nak tunjuk kat sini patutnya ada hypertension, ada hematuria, ada oliguria, okay, azotemia and hypertension. Kau tak silap. Okay. Okay, ni kidney stone. Okay, kidney stone ada banyak-banyak. Kenapa dia tak keluar? Ni risk factors kalau tak silap saya. Risk factors of those getting kidney stones. So kalau some people, men, they would say that kidney stones punya presentation is very very painful. Macam nak beranak dia kata. Tapi saya pun tak tahu macam mana orang lelaki tu tahu sakit nak beranak macam mana kan. Okay, so this is the sign and symptoms. Kesian family of these kidney stones ni. And type of kidney stone selalunya calcium oxalate lah yang selalu kita ni. Okay, tapi sekarang ni we seldomly take the stone and then do analysis sebab macam tak ada beza sangat. Okay, it doesn't really help unless kalau orang tu kita assume ataupun kita suspect dia ada cystine stone. So usually we may need to do some extra investigation on that. But usually bila doktor dah keluarkan kidney stones tu, macam dia dah one of the treatment kita dah tak ada cut and open. Unless the stone is very big, then we might have to do cutting and opening. Okay, but most of the time sekarang ni kita just guna laparoscopy yang just tebuk-tebuk and then kita pecahkan and then we would take it out ataupun nanti kita akan just allow the remnants of the stone yang dah dihancur-hancurkan tu keluar macam biasa. Okay. Right. Okay, so these are types of the kidney stones. Okay, ni kalau keluar sebiji macam ni, you boleh ambil ni buat batu cincin. So diagnosis, these are some of diagnosis. Ni kita bila buat x-ray, kita nampak lah stone kat situ, so dia opaque so because it's calcium macam bone juga, so bone kita nampak dekat x-ray, sama juga macam bone stones ni because of the calcium. This is a postmortem of a kidney. Nampak banyak stones dekat dia punya pelvis. Types of stones, ni staghorn calculi sebab dia nampak macam horn kan. Bila kita buat CT scan ni this is the calculus tu. Okay, kidney dia dah dilated dah. Ya, ni apa ni? Halia ke? No, this is another staghorn calculi. Alright. So management, kalau kita tengok stone tu very very small, less than like 1 cm macam tu, kita akan just buat konservatif, advise the patients to drink a lot of water. Sometimes kita bagi painkillers untuk kurangkan sakit, dan dia rasa macam nak muntah, kita bagi dia antiemetic, ubat tahan muntah. If it's larger stone, then we need to do all these things lah. Okay, tengok kepada the size and the patient's condition. Extracorporeal shockwave ni macam kita bagi ada wave that will hancurkan batu tu. Okay, hancurkan batu tu, so nanti batu tu akan keluar masa dia kencing nanti. Alright. Hydronephrosis is a distension and dilation of the renal pelvic calyces because of obstruction selalunya. Contohnya macam ni tadi. This is an example of a hydronephrosis because of a staghorn calculi. So the kidney is distended and dilated. Okay. So not only the kidney can be distended and dilated, sometimes your ureter pun boleh terlibat sama. So kita panggil hydroureteronephrosis. Right. So you can see here is the stone. Kecil je, tapi you see the consequences of the stone which can cause the hydronephrosis. Alright, acute renal failure. Acute renal failure biasanya kita clinically kita diagnose when there is a decline in the glomerular filtration rate. Okay, and then bila kita ada acute renal failure, you will have all these consequences lah. You akan ada gangguan ataupun imbalance on the extracellular fluid volume, ada electrolyte imbalance, acid-base imbalance, okay, waste accumulation. Alright, so these are the category of acute renal failure. Either the condition is due to pre-renal, renal, intrarenal ataupun post-renal. Okay, pre-renal tu selalunya dia melibatkan anything that kacau you punya blood flow. Okay, renal on the kidney cell tissue itself, post-renal selalunya disebabkan oleh obstruction. Okay. Ni contoh-contoh ni, enlarged prostate, kidney stone, bladder tumor. So these are the diagnosis, management. We have to correct the underlying cause lah selalunya. If we berjaya correctkan tu, and usually most people with acute renal failure, they will improve once the cause has been removed. Okay. Alright, chronic renal failure, kalau kita check GFR dia berturut-turut tu more than 3 months, GFR dia very very bad, okay, and then dia punya urea level tinggi, creatinine level tinggi, all the electrical imbalance is there, okay, and there are a lot of causes which can lead to chronic renal failure, and paling common hypertension, diabetes, okay, apa lagi autoimmune diseases. Okay, these are some of the presentation of chronic renal failure. Chronic renal failure, dia punya probably that person already has ataupun dia dah start ada chronic renal failure tapi dia tak tahu pun. Okay, it can be present for many years before you notice any symptoms. And kalau ada pun symptoms mungkin dia start with feeling very fatigue, tak larat, rasa macam very tired, usually because of anemia, and then because you have high urea lah in your blood. Okay, and usually kidney failure in a chronic cases, it looks a bit smaller than the normal size kidney. So management wise, we have to control whatever the underlying causes is, and also selalunya patient yang ada chronic renal failure, in the end they would be advised for preparation untuk renal replacement therapy sebab dia punya kidney dah tak boleh nak function normally dah, okay, because you have lost a lot of normal renal tissue, so tak boleh nak filtrate dah. Okay, nanti kalau tak filtrate, what happens, you may have acid-base imbalance, you akan dapat all this electrolyte imbalance, nanti you akan dapat uremia, you boleh fall into unconsciousness, and then you may die. So you need to have all the waste product to be excreted, kan? So kita kena ada a plan for renal replacement therapy, sama ada the patient can undergo hemodialysis ataupun peritoneal dialysis ataupun kidney transplantation. Okay, so hemodialysis ni yang you kita guna fistula, AV fistula, atrial venous fistula, whereby the surgeon dia akan connect the artery and the vein, buat connection kat situ so that the blood vessels jadi very big, and then it can assist with the hemodialysis. Okay, so hemodialysis is very very troublesome because you have to go to the hemodialysis center and have to do the dialysis 3 times a week. Okay, and then peritoneal dialysis ni dia macam hemodialysis juga, tapi dia tak ada pertukaran darah. Okay, because hemodialysis you do the blood exchange kan, dia masuk mesin and then dia filter kat mesin tu and then it comes back to you. Kalau peritoneal dialysis ni dia letak ada Tankoff, nama dia Tankoff catheter. It is be implanted in your peritoneum, sebab tu dipanggil peritoneal dialysis. So nanti kat situ patient tu boleh buat sendiri kat mana-mana, dekat dalam bilik dia ke, kat office ke, kat sekolah ke, tapi dia kena ada a special fluid bag yang dia kena guna connect to that apa nama tu, catheter yang dekat dalam peritoneum tu, and then dia akan buat exchange. Okay, so that is another type of dialysis. And then kidney transplant tu, because we do not have a lot of donors, so there are a lot of recipients who are waiting for their time to get the organ transplantation. Okay, so waiting list is very long lah. Okay. And then there is renal tumor. So macam I think I've mentioned earlier, tumor can be either benign or malignant. Benign tumors is not that common. Usually, most of the cases they tend to be malignant. Okay, and the malignant ones are usually renal cell carcinoma ataupun Wilms tumor in children. Okay, so inilah kenapa ni one of the classical histological appearance of a renal cell carcinoma adalah clear, dia panggil clear cell carcinoma sebab dia nampak dia punya sel tu very clear cytoplasm. Okay, and then it is arranged dalam bentuk nest, macam nest tu. Okay, so that is why it is called a clear cell carcinoma. Staging, so this Wilms tumor or nephroblastoma in children, they have a good prognosis, especially if it's diagnosed very early. Okay, alright, that's it. How the intake of painkiller can remove the painkiller does not remove the size of the stones. The painkiller is for untuk orang tu tahan sakit lah, sebab masa dia ada stone tu, bila dia ada, because there is a stone dekat you punya kidney tu, so the body will try to as much as possible remove the stone, sebab dia akan anggap stone ni is a foreign body, you shouldn't be having stones in your body. So body tu, your body akan try to expel. So bila nak try to expel tu, dia akan menyebabkan spasm. Kita panggil renal colic lah. So bila ada spasm tu, colic pain tu, it's very painful. So that is why kita akan bagi dia painkiller untuk reduce the pain. Okay, so the painkiller doesn't remove the stones, it's just to treat the pain. Macam mana nak remove tu? Kalau stones tu kita dah pecahkan dia through that ESWL, so kita akan advise dia untuk minum air banyak-banyak supaya dia akan keluar macam ikut air kencing biasa. So bila the stones dah dipecahkan in a very small macam serbuk dia jadi, so senang dia nak keluar, tak sakit. Mungkinlah dia rasa tak selesa masa nak kencing tu, so that's why we give them painkillers. Alright, so the painkiller bukan untuk remove. Okay, the only way to remove is either we do kita buat scope, kita buat laparoscopy, tebuk-tebuk, and then kita ada forceps tu masuk, and then kita ambil lah. Kalau size tu kecil, kalau size tu besar, kita kena kecilkan dulu size tu, and then baru kita remove. And then yang hancur-hancur macam hablo tu, we just let it be and then ask the patient to drink a lot of water. Okay, alright, any other questions? Don't forget to your attendance dekat iTaklim.
Okay. Doktor,
Yeah.
about quiz doktor, bila
Quiz.
kita akan buat? Sebab dekat dalam teaching plan ada untuk 3 dan 3 ni dia ada red line about quiz 1, topic 1 until 3.
Topic 1 until 3. Sekejap sekejap, I nak buka balik your teaching plan. Teaching plan sem 2. Quiz. Oh, patutnya hari ni quiz. Saya lupa you all ada quiz hari ni. Tak apa. So quiz 1, topic 1, 2 and 3. Okay, so it's it will cover blood vessels and heart, a bit of the respiratory system and GI tract. Okay, bila you nak buat?
Kalau macam tu nanti kita discuss balik kot. Okay.
Nanti bagi tahu. So sebenarnya quiz ni kita buat through Google Form je. Okay, and it doesn't go beyond 20 minutes pun. Paling lama pun 30 minutes lah, but usually 15-20 minutes macam tu. Current renal failure, is it irreversible? Yes, it is irreversible. acute renal failure yang reversible. And usually coronary failure ni it's due to complications from other serious medical condition lah. Okay. So dia start dengan acute renal failure. Kalau you treat it early, dia akan reversible. Tapi kalau you biar aja, nanti dia akan masuk ke fasa chronic renal failure, which usually happens gradually over a period of months to years, and then slowly your kidneys will stop working, and then last kali dia punya stage terakhir adalah kita panggil end stage renal failure. End stage renal failure ni yang selalunya memang dah kena wajib hemodialysis and whatnot lah. Okay. Okay, ada lagi soalan? Kalau tak ada, I'm assuming that you faham lah pasal kidney disorders ni. Okay.
Doktor, saya ada satu soalan. Soalan berkenaan dengan stone. Dia ada beberapa type of stone. Jadinya itu adakah dia berlaku pada satu spesifik tempat dalam kidney ataupun dia boleh berlaku mana-mana tempat dekat kidney?
Dia boleh, okay, dia boleh, it can occur anywhere in the kidney. Once dia macam dah start membentuk kristal kat situ, and dia ikut kata dia lah nak start kat mana, and then dia akan slowly accumulated, and then dia akan membentuk stone. And then selalunya dia start dengan kidney, dekat area kidney tu, and sometimes dia tak adalah macam dia tiba-tiba je wujud dekat ureter tu. No, ureter tu selalunya it started off dekat area kidney tu, mungkin masa tu because of the turbulence ataupun flow inside the kidney tu, the stone macam termigrate, and then dia sampai dekat ureter and then stuck. Okay, start, and then mungkin dia akan accumulate whatever ada debris kat situ, dia akan slowly accumulated kat situ, and then selalunya dekat ureter tu lah yang sakit, because ureter is very small and dia tak boleh nak lalu kan, and then your body akan try to expel that foreign body. So usually the pain is, it's very painful if the stone is stuck at the ureter. Kalau dekat kidney tu pun sakit juga, tapi macam this is based on testimonial lah. Okay, a lot of patient bila dia kata sakit sangat tu, and then bila kita tengok okay, dia punya stone dekat ureter. Okay, and bila stone tu dah berjaya dikeluarkan, mungkin it can come out on its own, masa dia kencing tu boleh terkeluar. Dia nampak ada batu. And usually lepas tu dia akan lega. Okay, so yeah, the stones can appear ataupun dia boleh start off in any parts of the kidney lah. Selalunya yang kawasan yang beruang, yang ada cavity, yang ada space, macam your renal pelvis kat situ selalunya. What's the best way to keep your kidney healthy? You drink enough water. Jangan give extra burden to your kidney. Contohnya macam if you ambil whatever jamu ke, supplement ke, chronically ingest painkiller, because all this will be filtered out by your kidney. Okay, so a normal kidney dia boleh filter, tapi kalau macam you bagi beban terlampau banyak, takut nanti dia tak boleh nak comprehend the pressure, so lama-lama dia boleh menyebabkan injury, ataupun mungkin whatever jamu-jamu ke ataupun beauty product that you take, we do not know what is the content inside it, and then probably mungkin dia ada some elements of steroid, and steroid is harmful for the kidney in a long term lah. Okay, sebab tu kalau orang tu ada macam orang yang kena ambil steroid because of some medical problem, kita memang bagi dia steroid walaupun kita tahu one of the complications of the steroid dia boleh affect the kidney, tapi kita bagi berdasarkan dosage, and then we usually do macam 3 monthly ataupun 6 monthly blood investigation nak make sure that the kidney function is not affected. Masalahnya orang yang suka-suka hati saja consume whatever mak nenek yang dia makan tu, ataupun makan ambil supplementary pill ke apa, kita tak tahu the exact kandungan, and then so it can injure ataupun dia bagi extra burden to your kidneys lah untuk filter out. Okay, and then be healthy lah. I think you all know, eat healthy food, drink a lot of water, enough water, do not smoke, don't take whatever makanan yang ataupun any substances that can be harmful to your body. I think that's the best way to keep your kidney healthy. Okay, not only your kidney lah, it keeps also your other organs in your body healthy as well. And of course, make sure that you try as much as possible, especially kalau you ada high risk. If you are high risk, macam contohnya your parents very strong family history of hypertension and diabetes. So these two culprits are one of the penyebab utama lah, okay, kerosakan ataupun kegagalan buah pinggang. Okay, so kalau you tahu you have your family background is very strong in hypertension and diabetes, so sepatutnya dari sekarang you really have to take care of your body, because kita tak nak nanti you will get hypertension and diabetes. Okay, so selalunya orang yang ada hypertension and diabetes, kita when they go for their follow-ups at the clinic, memang it's a standard procedure that we need to look at their kidney function, okay, to make sure that dia tak ada it doesn't progress to a very bad stage. Okay, kita nak kalau boleh, sebab dia dah rosak, so kita nak kalau boleh nak maintain as much as possible the function of the kidney. Okay, because dia tak adalah terus-terus akan rosak unless it is an acute renal failure. If it's a chronic, we try as much as possible to maintain the function of the kidney sebelum dia akan slowly progress towards end stage renal failure. Okay. Alright, any other questions before we adjourn? I was hoping that this slot would finish earlier because saya dah bagi recordings kan, so you can just ulang and ulang the recording that I've shared with you. Okay, so tak ada soalan dah Oh, lupa nak tanya. Any questions regarding the last week topic pasal was it hepatobiliary kan? I think it's hepatobiliary, I think last week.
Betul.
Tak ada soalan hari tu?
InsyaAllah tak ada.
Okay. Alright, so yeah.
Untuk quiz tu kalau nak weekend pun boleh je lah maksudnya.
Boleh. Boleh. But you have to make sure that you get all the consensus lah. Tak nak nanti macam daripada 38 orang setuju nak buat weekend, tiba-tiba ada 2 orang tak setuju nak weekend. So kalau boleh nak 40 of you agreed that if you want to do weekends, then it's up to you. I don't want. Tak nak nanti ada yang tak setuju, nanti kan adalah yang komplain, kenapa assessment buat masa weekend is the time that we're supposed to relax ke apa ke. Okay, so make sure that you get all the consensus from your friends. Okay, so kalau tak ada soalan, thank you very much for your time. We close this session with the recitation of Suratul As and Tasbih Kafarah. Okay, don't forget to log in for your attendance, yeah? Right, so thank you very much. Assalamualaikum. Take care.